Good morning, good afternoon, and good evening. Thank you for joining us today for a discussion on COVID-19 recovery, recognizing women's paid and unpaid work, hosted by the Wilson Center's Maternal Health Initiative and EMD Serrano, the healthcare business of Merck KGaA, Darmstadt, Germany. I'm Sarah Barnes, and I direct the Maternal Health Initiative at the Woodrow Wilson International Center for Scholars. For those of you who are unfamiliar, the Wilson Center is a DC-based think tank that brings fresh thinking and deep expertise to the most pressing policy challenges we face today. We work to create a global dialogue of ideas that Congress, the administration, and the international policy and health community can act on. At the Maternal Health Initiative, we focus on gender-related global health concerns, women's leadership, caregiving, and women's paid, unpaid, and undervalued work. In this vein, we're working on a white paper focused on the lasting effects of COVID-19 on women's health and economic participation. This discussion today will help inform some of the best practices and solutions that we will highlight in this brief. Today's discussion is focused on solutions to the issues we've all been hearing about, working on, and possibly experiencing ourselves for more than a year and a half, including job loss, increased caregiving responsibilities, increased rates of gender-based violence, need for flexible hours or work remote options, and an incredible amount of stress and pressure to perform even when policies and practices are not set up to support life during a pandemic. I want to thank all of our panelists for being here today and for the work that you do in this space. I'd also like to thank EMD Serrano for making this event possible, and to the Wilson Center's Middle East program for co-sponsoring this event, and a big thanks to my MHI team and our AV team. Today's event is only 1 hour long, so it is packed, but we will have time at the end of the discussion for an audience-led Q&A. So please submit your questions to mhi@wilsoncenter.org, and we will get those questions to the panelists. You can also follow the conversation on Twitter @Wilson_MHI using the hashtag COVID-19 recovery. So without further ado, I would like to introduce our moderator for today, C. Nicole Mason. Nicole is currently the president and CEO of the Institute of Women's Policy Research. For the last 20 years, Nicole's work has focused on issues related to economic security and poverty, women's issues and entitlement reforms, policy formation and political participation among women, communities of color and youth, and racial equity. Her writing and commentary has been featured on CNN, MSNBC, NPR, the Huffington Post, Essence Magazine, Politico, Real Clear Politics, the Wall Street Journal, The Nation, The Progressive, among many other media outlets. I cannot think of a better person to moderate today's discussion. Nicole will start us off with a bit of the landscape on the impacts of COVID-19 on women, and then bring in our expert panel to share their experiences in government, advocacy, and the private sector. Nicole, thank you so much for being here today. I turn things over to you.
Thanks, Sarah. Really glad to be here and be a part of this conversation. I just want to provide a brief overview of the impact of COVID-19 on women and women workers. So as you know, and at the beginning of 2020, we had a significant milestone. Women were more than 50% of the workforce. And by March of that same year, all those gains had been wiped out. And what the pandemic did was bring into focus not only women's disproportionate concentration in the hardest hit sectors, but the role of care work and women's unpaid and invisible labor and contribution, not only to the economy, but to families. And it also served to highlight our broken care infrastructure. During the pandemic, women were forced out of the workforce when schools were slated to open in September 2020. We thought, I myself included, that schools would be reopened. 865,000 women fell out of the workforce, mainly due to the inability to juggle both their full-time work and also caretaking responsibilities for both children and aging parents. And so a recent study by the New York Times noted that if women were paid minimum wage in the US, were paid minimum wage for their unpaid labor, caretaking responsibilities, and housework, it would contribute $1.9 trillion to the economy. And if we look globally, that would be 1.5 and then $10.9 trillion globally. That's a lot of unpaid, invisible labor that we don't account for in our GDP, but we know makes a difference in terms of women's ability to participate fully in the workforce and sustain employment. The last point that I'd like to make about this, here at IWPR, we've been looking at this issue for a very long time. And last year we did a report with Oxfam that noted that women spend 30% more of their time on caregiving responsibilities compared to their male counterparts, and Black and Latina spent a little bit more. But you have to know during the pandemic, those numbers were significantly higher. And we understand that women bore most of the brunt of caretaking responsibilities during the pandemic. So in this panel, we'll dig a little bit deeper and unpack these issues a little bit more and hear from advocates and organizations who are doing work and studying and thinking about this problem writ large. So I want to first start out by introducing our panelists. Really, we have a really great dynamic panel here. I want to first start out by introducing Lisa Ayub, who is the founder of Sudaka Jordan and the communication specialist for the Arab states at the United Nations Development Coordination Office. That's a lot. Sudaka's mission is to support a family-friendly working environment for women, focused on removing structural barriers that prevent women from entering and staying in the workforce. Next, I want to introduce Katarina Fodovat. Kat is the senior official in the Office of Global Women's Issues at the Department of State, where she leads a team of gender experts promoting gender equality efforts, including support of women, peace and security, countering violent extremism, promoting women's economic empowerment, and combating gender-based violence. She has over 20 years of experience advocating for gender and human rights globally, specifically in conflict and post-conflict settings. Last, I would like to introduce Jasmine Greenemeyer. Jasmine is the head of Global Strategic Partnership and leads the global initiatives Embracing Cares and Healthy Women, Healthy Economies for EMD Serrano. She oversees global unpaid caregiver and women's health partnerships with the aim to improve their physical, emotional, and financial health outcomes by advocating for systemic support no matter their stage in life. Such a great panel, a great esteemed panel. And I'm going to start off with Laura and ask her and pose the first question to her. How did COVID-19 impact your mission? And what has your organization's response been to COVID-19 related to women, work, and caregiving?
Thank you, Nicole, for that kind introduction, and to the Wilson Center and EMD Sirona for inviting Sudaka to be part of this timely and much needed global discussion on recovering from COVID and recognizing women's paid and unpaid work in a very critical time. So a bit about Sudaka, just very quickly to get the audience familiar. Sudaka means friendship in Arabic. We are a Jordanian civil society organization founded 10 years ago by a small group of women, working women, including mothers, activists, and professionals in the field of development and gender rights that were challenged by the unfriendly work environment they found themselves in. This created a collective sense of urgency and need for a tangible policy change. As certified community organizers by Harvard Kennedy School of Government, our mission is to continue advocating for an enabling work environment by removing the structural barriers preventing parents, especially women, from entering and remaining in the workforce. As we are all familiar, and as this global pandemic showed, these structural barriers still include lack of daycares, access to safe public transportation, and unequal pay. A bit about Jordan's landscape. We have sadly, one of the lowest economic participation of women in the world, and it stands at a very stubborn 14%, a number that hasn't nudged in the last 10 years, despite all the efforts on the ground to find that tipping point. 78% of women have a university degree, and unemployment is on the rise, especially among married women with children, and this is where the heart of the problem lies. Again, statistics show that women tend to exit their career when they get married around the age of 29, and 34% of women leave the workforce when they have a second child. So imagine their environment during COVID. Another statistic shows us that from our research, Sadaqah's research, that 47% of women refuse a job opportunity due to transportation challenges. So imagine that in lockdown. What I'm about to give you is how we combated the pandemic, a bit about our background work, which we leaned on when the pandemic hit. So we started raising national awareness and advocating for implementing an existing yet dormant labor law, which was Article 72, which used to call for the provision of daycares at institutions that had 20 women or more with 10 children under the age of 4. Simultaneously, we worked through a coalition that we led to amend the law to make it female gender, to remove the female gender stipulation, to affirm that childcare is gender neutral responsibility. And this was achieved right before the pandemic hit in 2019. We also worked to amend the guidelines to incentivize employers by introducing new daycare models and different forms of contracts to accommodate the needs of employers and employees, and also offering technical support in daycares. So we also have a training academy that gave us access to lots, like approximately 300 caregivers and 200 daycare owners. And through one of our programs called the First 5 Years, we could measure the impact of COVID. It gave us an ear to the ground, because when we were in lockdown, we were able to reach out to them and start to measure how this affected their day-to-day life and take this information back to the officials. All of the work I just shared came before COVID, and under the National Framework for Workplace Daycares, a Sadaqah ILO initiative, which has been modified 3 times to date, recently this year, and it is in coordination with the Ministry of Social Development. Before I wrap up, I just would like to say that in Jordan, and since COVID hit, 20,000 women in Jordan lost their jobs, alongside the 115 million people all over the world that lost their jobs, according to the ILO Monitor. And our attention has been heavily focused on the social protection of daycare owners and caregivers, as we believe the care sector is a backbone for employment and employability for women and should continue to be a national priority. And this dialogue today will grant us the opportunity to exchange knowledge and best practices and grow together to combat each other's challenges within our countries. And thank you. Over to you, Nicole.
Thanks, Laura, and thanks also for really just highlighting the how vital daycare, childcare is to getting women back into the workforce and helping them to sustain employment, and also providing a bigger global lens for us to be thinking about these issues and be connecting the dots. And so, Kat, I want to turn to you and your work and ask you to talk about what kind of policies or programs does USG have in place to support women during the COVID-19 recovery. So talking about those policies and programs.
Sure. Good morning to everyone. Thank you, Nicole. Good morning to my fellow distinguished panelists. And thank you so much, Wilson Center, for having this important discussion on the topic of ensuring women's healthcare during and after the pandemic. We have all seen the direct impact that healthcare and lack of it has had on our global economy. So before discussing the recently released White House gender policy strategy, I'd also like to recognize EMD Serrano and Lynn Taylor from EMD Serrano for being a longtime partner of ours on our Healthy Women, Healthy Economies in Asia Pacific Economy Cooperation, since the initiative was established way back in 2014. So it's been many years, and I look forward to continuing to work on our Healthy Women, Healthy Economies going forward. Just a little bit of background and our structures and policies. In March 2021, President Biden, through an executive order, created the first ever White House Gender Policy Council. It was actually on International Women's Day. And this policy council reports directly to the president. It's the first highest level council ever in our nation's history that reports directly on gender to the president. One of the first tasks of the Gender Policy Council was to draft the US government's first ever national gender equity and equality strategy, or the gender strategy as we all call it. I'm pleased to say that the gender strategy was released by President Biden and Vice President Harris on October 22nd. So it's only been a little bit over a week. The gender strategy sets an aspirational vision and a comprehensive agenda. It's very holistic to advance gender equity and equality in domestic and foreign policy. and demonstrates that families, communities, and nations around the world stand to benefit. The strategy contains several priorities, from improving economic security, preventing and responding to gender-based violence, increasing access to healthcare, and advancing democracy, rights, and the full participation of women and girls in social, economic, civic, political life, and among others. What's really important in the strategy is it really takes an intersectional approach that considers barriers and challenges faced by those experiencing intersecting and compounding discrimination and bias related to gender, race, and other factors, including sexual orientation, ethnicity, religion, disability, age, and socioeconomic status. This includes addressing discrimination and bias faced by Black, Latino, and Indigenous and Native American people, Asian Americans, Native Hawaiians, Pacific Islanders, and other people of color. Realizing this bold vision is a government-wide responsibility. It will require implementation across every White House office and executive agency. It will also require accountability, consultations with civil society and private sector, and engagement with all of our partners. So working collectively and strategically, we can achieve our collective vision for gender equality and equity at home and abroad. And that is kind of the scope of how we have been focusing our policies and programs in effectuating a whole of government effective gender equity and equality strategy.
Thanks, Kat, for that overview of the new Gender Policy Council. And want to say that document is reflective of it was a group effort, both internally in the government, but also among women's organizations. And so it's really reflective of all of our priorities. And so I'm really excited about thinking about how we implement those strategies and both inside the government, but outside as well. And so I want to turn to you, Jasmine. So we've talked about, Kat has talked a little bit about the government's response to some of these issues around care, women in the workforce, gender equality. But can you talk a little bit about the role of the private sector, in relationship to women's health and economic recovery, and what steps can companies take to be a part of the solution?
Sure, Nicole, it would be my pleasure. And thank you for moderating this session. And I also want to thank the Wilson Center, Sarah and Dikshita for hosting this event. And Kat, on behalf of the Healthy Women, Healthy Economies team, I'll make sure Lynn has your warm regards. We're very excited to be continuing our work with you. But today, I'm honored to be a part of this panel and to talk about something I'm very personally passionate about, and thankful that EMD Serono also sees this as a critical component, not only to our continued success as a multinational company, but also to the economy at large. And as you alluded to, Nicole, often this is framed around what governments can do. While they absolutely do have a critical and crucial role, we believe that the private sector should not forget they also have an important role to play. And while the private sector can't create public policy, we can create impactful policies for our employees, right? And if this is done at the mass level, we can significantly improve the lives of women who are so often disproportionately impacted by these economic events that we've recently seen. And I believe that companies shouldn't limit themselves to looking just internally, right? We really strongly believe in public-private partnerships, that they're an essential form and of collaboration between the sectors and bringing together resources and expertise that would otherwise be missing if we're working just in silos, right? So while the governments need the buy-in of the private sector to enact these sweeping changes we need, I think conversely, governments need to think about policies that incentivize the private sector to actively support women and family caregivers. And this is often an area where governments and employers need to work jointly to create these policies to protect these often economic vulnerable segments of the workforce. And at EMD Serono, we've been honored to work with the State Department, initially with Ambassador of Global Women's Health Issues, Kathy Russell. She helped spearhead a work stream on women's health and economic empowerment within the Asian Pacific Economic Cooperation. This is a multinational or multilateral forum comprised of 21 different economies in the Pacific Rim, including the US. And as part of this initiative that Kat alluded to earlier with Healthy Women, Healthy Economies, our company collaborated with the US government At the time, this was the State Department, Health and Human Services, and the Department of Labor, other governments, other employers, and experts to develop a policy toolkit. And it was specifically looking at the barriers to women's health and economic participation, and provided quite a plethora of gender-specific policy options that APEC member economies could draw from, pilot, and scale up. So I would conclude by saying that we take it very seriously as a private sector partner to take care of our own house, but we also see the inordinate importance of private sector partnerships to enact systemic policy support and also lasting cultural support for women who make up the majority of underpaid and unpaid caregivers. So Nicole, thank you, back to you.
Thank you. So I just want to say that when I think about the role the private sector has to play here, I think it's really huge. And we've seen many businesses sort of step up to the plate and really start to grapple in real time with these issues and make policy changes, to their workplace practices and policies in real time. Because I always think about the fact that even though federal action is really, really significant and important, women are going back into the workforce today, and they'll be interacting with private sector employers who will determine whether or not they're able to re-enter, but also not only re-enter, but sustain employment. So I think the private sector has a really critical role to play here. So I just want to open it up and for a brief discussion before we go to Q&A. So I just wondered if each of you could speak to how, in your perspective, again, government and companies can be solution oriented and really be thinking about, for me, I frame it as like the future of work. Things have changed. We're not going back. We know that flexibility works, and we know that flexibility matters to women and families. And so how can companies be responsive? People have been talking about it as the Great Resignation, where 4 million workers have left the workforce, but we've been framing it here at IWPR as the Great Renegotiation, where workers are really thinking about what would make work for them. And so how can government and companies be more solution oriented and really be thinking about this moment that we're in?
I can jump in. I think we all can agree, and we've alluded to this in different ways, right? To help women's paid work, we need to look at supporting their unpaid work, right? And I think when it comes to unpaid care, there's a lot of ways that the private sector can create and foster a more equitable work environment for women to rise and thrive in the workplace, right? Mm-hmm. And one of the ways you alluded to this, it starts with supportive policies. And I love what you said, the future ways of working, because that's actually the work stream that we kicked off in our company. It's actually before the pandemic. And interestingly enough, the reason we had been looking at as a company is that millennials and Gen Zs are very, loud in letting employers know that they want to have greater flexibility. They want to be with their families. They want to be highly responsive. So we took on and rolling out a series of policies that include flexible hours, remote and hybrid work models, job sharing, and paid leave, so that no employee has to think about, I have to make a choice between caring for my family and employment. But we've also gone deeper on that, and we're very conscious about how you retain and recruit employees and looking at the implicit bias that sometimes is present in that. And with our internal Women in Leadership Employee Resource Group has been very helpful. And one of the key things that they recommended right out the slates a few years ago was to ban manels, all male interview slates. But we also look at, how we're retaining and promoting women, and we've set benchmarks around that, to make sure we have gender parity in executive leadership roles. In fact, we have a goal by 2023 around that parity. It's very public in the company. We have executive sponsorship. We've also worked on parity and succession planning, and we also do unconscious bias training. So in short, I think, there's a lot that companies can do intentionally, right, to break down some of the barriers affecting women's participation in the workplace.
Yeah, and I think that's right. And remembering that it's not a one-time thing, like it's an exercise that you keep going back to, you keep thinking about workplace policies and practices, the hiring process, the recruiting process, the retention strategy, all of those things. Like it's ongoing and not just in this moment. So I think that's really important. Kara, Kat, do you have anything to add?
Sure. I mean, I agree with Jasmine completely. I think we've seen certainly what I call opportunities from this pandemic of changing the way we work and closing workforce gender gaps, which would add between 12 and $24 trillion in global GDP. So I think also a critical part of addressing this and that part of the gap is to work to address all the uniquely gendered barriers. So that includes advancing women's leadership, addressing the caregiving crisis, as we have all talked about, addressing gender-based violence issues, and ensuring high-paying quality jobs. Most of us recognize that these issues are interrelated. And in order for women to advance in the workforce and assume these leadership positions in all aspects of society, we really must address the issue of women in the workforce and the care economy. These issues have been put into sharp focus as a result of the global pandemic, and it's something that we really need to take the time to address. I mean, in the United States alone, an alarming number of women, almost 3 million women, have exited the labor market. And they've been forced to choose between employment and providing adequate care for loved ones. And Vice President Harris calls this trend the national emergency. And it increases unpaid care, which is concerning for families with young children from underserved communities where mothers are more likely to be sole or primary breadwinners. And they may face financial hardships for years to come. So this has really knocked women back in so many ways. And the economic value of unpaid care work is substantial and important for every economy in the world to address. However, unpaid care work is not counted as part of the economic activity because it's difficult to measure. It's based on traditional market metrics, and it really negatively impacts the labor supply as fewer women enter the workforce due to their unpaid work commitments. So I think, the COVID-19 pandemic amplified these unequal burden of care work, often shouldered by women and girls, and women take on, as we all know, a disproportionate amount of care work compared to men, which is often unpaid and undervalued and can further marginalize women living in poverty, female heads of household, essential workers, among others. And, by investing in care work as a key type of infrastructure in the post-pandemic economy, this elevates the vital labor that women, carry out. So I think pandemic recovery plans cannot simply work to bring economies back to their pre-COVID status. Instead, they really have to work to have economic recovery plans that must incorporate the most marginalized workers and undervalued industries, especially women.
Great, thank you. Thank you for saying that, Kat, and just providing this larger, this larger context in terms of, it is an emergency, a national emergency when we think about the steep drop in women's labor force participation. And one of the things that I think that's really been great, and this, Laura, I'm sorry I didn't give you a chance to answer this question, but I want to pose this different question to you. Like early on, sort of being able to frame what was happening. At IWPR, we, named it and called it a she session because we saw that women were being disproportionately impacted by job and income losses. But what I have really liked about what's happened over the last year is that many of the conversations that many women were having in private about the struggle of care and the caretaking responsibilities became public conversations. And so you had women in the C-suite talking about their caretaking responsibilities, but also women on the front lines who are working in grocery stores talking about their the burden of care, the role care has played in their ability to sustain employment. And so it became took it into the public sphere, and the media started to pick up and share these stories and really grapple with care. And social media really played a role in that because women were also sharing their experiences on social media. So Laura, could you talk a little bit about how you all have used social media to amplify these stories, women's stories, but also your work, and help to articulate and frame the problem?
Sure. Thanks, Nicole. And everything that was discussed is really important, especially that the pandemic proved that the entire economy relies heavily on the care economy. And it's very unpaid, it's highly gendered. And one of the problems of the pandemic was that we were shut down from meeting face to face. So media and the online and the digital divide that we experienced was the only way to communicate with the outside world and push our strategies and re-strategize to continue to put the care economy on the table, especially the unpaid work, which most of the women suffered from. One of the things that we needed to share with the public was the importance, because I think it was you, Kat, that was talking about the increase in gender-based violence, gender-based violence was the 5R framework that we needed to circulate or explain to people while they were at home. The 5R framework, the recognizing, reducing, and redistributing the unpaid care work at home, because women started to have the burden of the household pressure of online schooling and working. And so there was an increase, and she was uninformed maybe, and that we needed to protect her indirectly. So we created a podcast channel where we could push out episodes. And in Jordan, just to give you some background on what happened, we had a lockdown for 3 months and daycares shut down completely. And daycares, they get their fees once a month from the parents. So they had the operational cost running. However, there were no students or no parents paying. So the government shut down out of a defense law. They closed down the daycares, and we needed to open the daycares, and we only had social media and our network, also including the government officials that were pro opening the daycares, the media, the activists, the lawyers. We had all these experts that communicated through a platform that we created called Voices of Women Workers, where we brought in experts to look at the problem of shutting down a backbone for employment for women. How can they go to work if there were no daycares or parents, to be honest? It's not just about women. It's about creating it for men and women, because in my case, personally, my husband is an architect. He works from home. He takes care of the kids. I go out and work. So we crafted a Twitter storm twice. When the daycare shut down twice, we crafted a Twitter storm with customized messages. And where mothers, fathers, daycare owners, caregivers, activists joined using a specific hashtag carrying targeted tagged messages of officials that we needed their attention to the matter around one goal, which was to open the daycares. This tactic allowed us, we succeeded in opening the daycares in Jordan twice through the collective consistent pressure, and the content that came from the live Facebook platform, which we created called the Voices of Women Workers, allowed us to produce 3 policy papers, which we sent to the government. And this created a dialogue and kept the momentum on, the pressure on. And if we look at the situation today, we haven't seen the real impact of the pandemic. We're still just a few months after lockdown. We need another maybe year to see the economic wreckage that has happened to us, whether here, whether around the world. And if we do not find through our emergency COVID response plan, we discovered that partnership and collective participatory dialogue was key in pushing policies to protect what is left from this already fragile situation, which, like in our business or in our work, the care sector. And I would recommend and ask you, and if you look at the cake theory, which is something we came across a while ago, it's the cake theory of gender and the cake theory economics, which shows the layers, which also Jasmine, you were talking about, how it's like a cake. The bottom layer is Mother Nature, which is like foods and survival. The second is the love economy, which is the care economy, which is non-monetized, which is the unpaid care. And the middle is the underground economy, which is the informal sector, that's where a woman, she's not accounted for, she's not recognized, but she does probably make some money. It's an informal sector. And the monetized part is the public sector and the private sector, who are responsible for infrastructure, for policy, so we need to work together. But the base of it, the thing that carries the economy, is the care economy. And without it, it won't be possible. Thank you. I took much time. Thank you.
You're right about, without the care economy, nothing else is possible. And that's why I really am a strong advocate we've treated care as the private obligation of families rather than a public good. And so I'm really a strong proponent of thinking about, care as a public good that everyone can tap into, and we recognize its worth and value and contribution to the economy and also the GDP. And so Kat, I want to talk to you a little bit more about the Gender Policy Council report. And so I've read the report, I've engaged it with with the Gender Policy Council around it, but want to talk a little bit about how we will go about implementing. This is a really huge charge, thinking about cross-agency collaboration, but also NGO participation in the implementation. So can you talk a little bit about the implementation of the strategies outlined in the document?
Sure. And Nicole, just as you've said, this is just a huge charge. It's domestic and global in nature, and it really is a whole of government approach. So we're hoping that this really sets the baseline for where we need to go and the vision for where this administration will be working. On the gender strategy in terms of healthcare, states healthcare is a right, not a privilege, which I think is such a huge statement to make. And, with that as a cornerstone, making sure that we're ensuring equitable, high access, high quality, affordable healthcare is one of the goals. Protecting constitutional rights to safe and legal sexual reproductive health, while promoting sexual reproductive health rights at home and abroad, closing, disparities between maternal health care and reducing maternal mortality, providing comprehensive health care, including culturally sensitive and trauma-informed. So we really want to make sure to have survivor-centered approaches. The overall strategy itself really has 10 points in it that look at everything from economic security to justice and accountability, to healthcare. And so making sure that we're kind of using this as a baseline across every single US government agency is quite a task. We will all have our own implementation plans. In addition to that, we will have metrics and accountability measures that we will work very closely with civil society organizations and the private sector, because honestly, we have to have a unified approach at every single level. I love the cake analogy, actually, that Laura had brought up, but looking at every single area that we can kind of pull in and have kind of that strategic approach. It will take everyone that we can in the government, but we've had amazing leadership so far across every single government agency. The other piece of the strategy itself, as required by the executive order, which I think is quite groundbreaking, is gender budgeting. So it's great to have strategies and it's great to have all these things, but if you're not resourcing them, they really are unlikely to happen. And we see this all over the world. So we are very, very encouraged by the fact that gender budgeting is something that OMB is actually charged with working on. So the strategy itself will be implementing with resources work to provide for gender support.
Yeah, that's right. We do need money and resources and investments. So like not the, our values, the report, ensuring that there's investments to be able to support those strategies over the long term. It's going to be really very important. And we're almost to the Q&A portion. So if you haven't done so already, please make sure to email your questions to mhi@wilsoncenter.org so that we can get those questions in and be able to ask some of our panelists. Well, why don't we just go early, to the questions, because we have one. So this question is about women in the sectors such as home care, childcare, and fast food, which are largely non-unionized jobs and more prone to workplace harassment, abuse, and violations. Can you all speak to any best practices and solutions for women working in this type of work? I have some ideas too, but does anybody want to?
I can talk about a couple of them. We've had a few programs that really work in the informal care sectors, where formal labor unions might not be what they're working on, but they do have networks of women that work together. So for example, in some local markets where there are things that issues that we have called sextortion, issues of market owners sometimes basically expecting sex for placement of women in markets, other things like that. Women have come together to network in these markets to basically have their own informal union to push for their rights and their protections. Also having best practices among them, building capacity building for how to push back and have a rights-based approach in the work that they're doing. So by collectively working together and effectively unionizing in an informal way, they have been able to push back against a lot of these violations, and also working with local law enforcement where possible, and other civil society organizations. So that, and also the media, to be honest with you, the media, when organizations and when women's groups partner with the media, a well-trained media that is sensitive to the needs and challenges that face women, the media can also be a powerful tool.
Does anybody else want to answer the question around, women who are non-unionized, or I would even say women who are most vulnerable because of the kinds of jobs that they are in, that have fewer benefits, less job protections, and especially in the informal economy, like domestic work, maybe undocumented or have status issues, how that might impact, their ability to, again, be safe in their employment, and also be treated with dignity. Well, I have some, Laura, go ahead.
No, I'd just like to say that it, in the childcare sector and home care, as caregivers or any woman working, which is a very feminized sector, it's very helpful for every woman to be aware of her rights, labor rights of her country, depending where she is. And for us, community organizing has really helped us build momentum. Like if there are a group of women, daycare owners or childcare givers, to organize themselves together and create together they can build momentum to put together their needs, reach out to the government officials that can help them to listen, and also reach out to organizations that are civil society organizations that can deliver their message. Like for us, when the daycares shut down, they approached us because of their operational cost. They were not receiving their salaries. We, as a hub or a union, we were described yesterday by the Ministry of Social Development as a union for caregivers, because the daycare sector, because they don't have any union amongst each other. So you can help them at least be heard, amplify their voice. And like Kat was saying, through social media, through different techniques. Now it's not like before. I think the challenge is to get more than like workplace harassment is not easy for people to come out and talk about. People tend to be very reserved and afraid. They don't want to lose their job. They're willing to tolerate it, which is breaking a taboo. Like, you know, there are a lot of things that people have to go through emotionally, especially now, to come out and speak about it. So collectively, this is why community organizing has worked for us as a methodology. Reaching out to a civil society organization that resembles them, has the same shared values, meet with them, talk about your problems, and see how you can find solutions, and getting your voice to those officials or those people that can actually secure or lead change. And protect. The social protection here is, again, something that is on the top of the list. We need to social justice and social protection by listening and tuning into. We have to build trust. For us, it was building trust with the daycare owners and caregivers. So, and whoever's asking that question, we're happy to connect later and share some tools and tips on taking that forward.
So I want to lift up, thanks Laura for saying that. I think it's really hard for individual workers to fight back against these really big, large issues, systemic issues like harassment with very few protections, legal and otherwise. And so I just want to amplify some of the efforts I know here in the United States with the Domestic Workers Alliance and the Domestic Workers Bill of Rights, which is a set of rights for domestic workers or women who are working in the informal economy, you know, to make sure that, again, they're protected from harassment, receive wages, their fair wages, and also thinking about the Build Back Better plan, where there is a provision, you know, investments in the care infrastructure, specifically home care workers and the care sector, so that we can raise wages and also improve working conditions for those workers. So those are things that I think are really important. And understanding when I talk about the impact of the pandemic on the informal economy, we have to understand that women who are employed in the informal economy, whether they are, you know, providing care, daycare to families and getting paid under the table, or domestic services like cleaning homes, when families or women lose income at this level, it directly impacts this sector of workers, the informal sector. But the informal sector, the people who are concentrated in those sectors, also are not able to tap into programs, social safety net programs like unemployment insurance. And so it's even more devastating. And I have to say, because of the informality or the less, you know, we don't count it. I think that the economic impact of the pandemic is even bigger than we know. So I just want to say that. So, all right, back to the question box. I just love these questions. So, to what extent do cultural values determine the assignment of care responsibilities to women and create barriers to their paid employment in specific societies? And how are the panelist organizations addressing this challenge? I love this. Feels like a softball question to all of us. So, but why don't I start with you, Jasmine? And ask you to weigh in.
So forgive me, the question is, how are cultural norms impacting women having to do more unpaid work?
Yeah.
Oh, goodness. Well, it's very interesting. As being part of a multinational company, you know, we really concentrate on North America, EU, and the APEC region. And we look at not just how women who have children, but also the cultural expectations for women in caring for loved ones who have chronic illnesses, or just a person with a disability or older and such. And so there's huge ramifications in different parts of the world where the expectation is that the woman will drop out of the workforce at an earlier stage to care for loved ones. And so I just think there's a huge underbelly, you know, not just looking at how women hopefully have a career if they want to have a career, and the impact for them right in their home and caring for children, but just all the ripple on effects of caring throughout the lifetime, right? And just the different stages of how women are impacted. So that's some of my immediate thoughts. I'd be curious what others would say to that as well.
Thanks, Jasmine. Laura, Kat? You don't have to, every question is not for everybody. So if you want to, we can go to the next question. Because we have.
I mean, I think I would just note, I think the cultural barriers that face women, and certainly, a lot of whoever's in power often sets that standard. So a lot of the laws and practices that are put in place by the people in power. So that dynamic certainly lends itself to how, care responsibilities are put on women. Barriers to women are implemented in terms of their ability to access finance, their ability to get into the workforce, high paying quality jobs. So I think there's a huge impact of culture on women in the economy, and something that whenever we work in any country, that is something that we always try to address. Certainly, women's movements are based upon changing cultural values, and that is something that, again, taking an intersectional approach, we also need to make sure that we're looking at all the intersectional issues and challenges and barriers, even beyond gender. So I think that it's a great question, and something that people need to address whenever you're doing any kind of analysis, gender analysis, or, before you start doing any particular work anywhere, really getting into a localized approach and understanding what the challenges are that are facing that community.
And
I'd like to add to that, Nicole, please, if I may.
Yes.
Just very quickly, during the pandemic, we actually published a policy paper, and one of the recommendations in one of our 3 policy papers, one of it was to define the head of the household, and we recommended that it should be expanded to include a larger set of social categories, particularly women, and that the existing standards rarely recognize women's role as economic providers and exclude a majority of working women from government support, and protecting daily wage workers and out-of-job male and female workers should be perceived as a right and build on principles of empowerment and support through social security concepts, as well as through programs that the government should provide. And these are all social norms and social gender norms that they were always there. It's not like they weren't there. They were always there, but they were exposed much more during the pandemic. So cultural norms, and like Kat was saying, zooming in on the local essence of every single element and how we are perceived and how things are designed should be also taken into account.
Yeah, and I think we can all, say without much exception that globally, culturally, women are expected to perform or be responsible for the majority of caretaking responsibilities in society. So, at least in the US, when in fact women are 50% of the workforce and are expected to contribute to the household or breadwinner mothers. And so thinking about how do we shift and talk about the cultural norms and expectations of women when in fact our workforce, women's labor force participation globally has shifted significantly over the last 50 years. So this question, we're short on time, but I think this is really important because this really cuts to the heart of our conversation, especially as we're talking about policies and changes and what we want to see in terms of thinking about how we might tip the scales and have a bit more balance. Paid sick leave. So, can we talk a little bit about, the importance of significance of paid sick leave in this moment for families? The US is the only country, developed country that does not have paid sick leave policies. And as many of you all know, the US spends less than 1% of its GDP on care policies. So could you, and then it got kicked out of the Build Back Better bill. Now it's back thanks to, advocacy from organizations across the country. So could you all talk about the significance of paid sick leave to families here in the US, but also globally, and what it's meant for women's labor force participation?
Well, I can kick us off, but I'm sure others have lots of good things to add here. I'm so glad you're bringing this up, and I'm so glad advocacy led to this being back in the bill. It is a huge moment that I hope we reconcile. And as you alluded to, I think there's been different reasons as to why, I think we've all worried about how's this going to be paid for, right? And it's definitely being tackled at an infrastructure level, but this is very important to families who care for loved ones with cancer, loved ones with MS, and we need to think through the implications of being able to care for your loved one by taking them to medical appointments, to being with them when they're intensive treatment, to being able to grieve if you lose a loved one. I mean, there's all these various components, but I'm sure Kat and Lara have other things to add, but I'm just so relieved that it's back in play.
Yeah, I mean, clearly, the Biden-Harris administration also feels very strongly that, this is something that needs to be a part of any kind of pandemic recovery. You can't have pandemic recovery if you don't have paid sick leave, because you're, putting people at risk. People will have to feed themselves. They have, you can't actually even take time off to recover. You can't take care of sick, loved ones. It makes sense and is the most effective way, not only to deal with the economy, but also to create stability and recover from a global pandemic. I think across the globe, we have seen how vital this is, just to make sure that people can take that opportunity to heal. The moment that you need support the most is when you are ill or a loved one is ill. And, in order for the global economy to continue and not falter, even from an economic, you're just making the business case, this is the best way to run it. I think that the private sector in many cases leads the way. And we really, look to a lot of the innovative, really supportive private sector organizations. But of course, we also need the activists and civil society organizations to continue to push, media organizations to continue to push, tell the stories, and make people understand why this is a vital part of, any economy. And the US should certainly be leading the way on this. So I'm also very glad to see that it's back.
It's back, but it's 4 weeks instead of 12 weeks. But we'll get there. We'll get there. I think that when I think about the Build Back Better plan and some of the care policies, paid and sick leave and other things, it's really a down payment on the future. We know where we're going to go, and it sort of puts a stake in the ground in terms of our value and commitment. So I'm still very much encouraged. Laura, did you want to add anything here?
No, I just wanted to touch on some keywords that you've all discussed, which is like advocacy, the value of advocacy, and working with civil society and bringing everyone to the table. And from our point of view as Sadaqa, it has proven successful if you partner with organizations, including the government, including the state, with political will to lead the change. Change can happen. We don't have time to share it here, but we have repurposed existing funds through our donors who have a feminist approach, by working with the government as well, to opening the sector and to repurposing the funds to cover costs of daycares that have been shut down and could vanish because of all this pandemic. But like you said, Nicole, 1% of the GDP, the national budget is for care economy. That's not what we should aim for. Every country should, or every civil society organization or any advocate or activist should focus or work towards increasing or putting the responsibility on the state to increase the budget or put it on the national agenda. Care economy equals this much amount, because in cases like the pandemic, we are still suffering, and some sectors will vanish because they were not protected through social justice or social protection. So we hope that we can see more of that. We can work together to increase the national budget to protect these fragile sectors.
Great. So we're at time. Okay, we only have 2 more minutes. And so I just want to ask the panelists if they have any final thoughts or anything that if you're going to leave the audience with anything, a word or two, or something you think we should be focusing on collectively, I would love for you to share it right now. I always like to end on a high note.
I can jump in.
Laura.
I can jump in. Just from the Biden and Harris administration, and the State Department's Office of Global Women's Issues, we are so committed to supporting women in all of their diversity. So I think I would like to emphasize, if you have power, empower, and make sure to have sharp elbows, make room for others at the table. The gender strategy really is a historic effort, and we look forward to this kind of being a roadmap for how we achieve these goals. And thank you so much to the Wilson Center, and thank you, Nicole, for moderating, and my fellow panelists. This has been a great opportunity. Thank you so much.
Thanks, Kat.
I'll just say we look forward to working together, right? We can go further, faster.
I would just say amplify your voice, speak on behalf of yourself and other women, and hopefully we'll get through this. Stay hopeful.
Yeah. Thank you. I'm very hopeful as well. And together it seems to be the thread or the word that links us all. And acceleration. I'm all about acceleration in this moment. And so I'm really hoping that we can have some big wins around some of the things that we really care deeply about. And I also want to thank the Wilson Center for pulling together this panel and inviting me to moderate this morning. And I'll turn it over to Sarah.
Thanks so much, Nicole. I'm coming right back on. Thank you so much, everyone. This was a really illuminating conversation and discussion, and I look forward to staying connected with you all and partnering together in the future. The recording will be out later today. We will share that with everyone in case you couldn't view this live. We will also be creating an event summary, which will be published on our blog, the .mom column on New Security Beat. And that is it from us. So thank you very much, everyone. Enjoy the rest of your day and evening. Thank you.